Good morning friends, I am Dr. Anirudh and today we will be discussing about the common condition of anal fissure. Anal fissure is a common condition affecting the anal canal and it can occur in people of all age groups and can affect both men as well as women, even elderly people and children. A fissure is basically a crack or tear in the internal lining of the anal canal, and it usually forms when the delicate lining of the anal canal is disrupted by passage of hard stools, which occurs as a result of constipation or drying of the stools. It can also occur as a result of trauma to the anal canal during childbirth, or it can occur as a result of infections of the anal canal, and sometimes in children because of severe bouts of diarrhea, a fissure can form in the anal canal. This is a very painful condition because the mucosa of the anal canal is very delicate and supplied by many nerve endings, and this causes the surrounding muscles to go into spasm, which further decreases the size of the anal canal and causes obstruction in the passage of stools. So besides pain, the other symptoms of an anal fissure can be itching, burning sensation around the anus, and also some pus or watery discharge. Sometimes a small skin tag may also be present at the end of this fissure, which protrudes outside and causes irritation after the passage of stools. The diagnosis of an anal fissure is usually confirmed on the basis of the history as well as the clinical examination. When the doctor examines the patient with anal fissure, the patient is usually in severe pain and there is spasm of the anal sphincter which causes a puckering of the skin around the anus. Digital examination in these cases is usually not possible and not advisable, and the fissure can sometimes be visualized if the buttocks are spread apart. The treatment of anal fissure depends upon the duration as well as the severity of symptoms. In cases of acute fissure, which is of recent onset, the treatment is usually a medical treatment. This includes a combination of diet modification, laxatives, hot sitz baths, and some creams to relieve the spasm of the anal sphincter, and also painkiller medications. This treatment can usually be continued for 10 to 15 days and is successful in relieving the symptoms in many patients. However, when the fissure is of long standing, of more than 4 to 6 weeks in duration, and the symptoms are severe, and when there is a lot of bleeding and pain, and also there is a large skin tag, the medical management is not successful in relieving the symptoms. In these cases, the treatment can be by the means of a simple surgery which is known as lateral anal sphincterotomy, in which part of the internal sphincter of the anal canal is divided. This helps to relieve the spasm of the anal sphincter, which ameliorates the pain of the patient and also increases the blood supply to this area, and this ultimately results in healing of the fissure. This surgery can usually be done under regional anesthesia and as a daycare procedure, and the patient can be discharged home the same day or the very next day, and the results are very good.